Chris here again, Southern Homegrown. I wanted to talk to you a little bit about postpartum after the baby's here and kind of what may happen afterwards. Generally about days 3 to 4 and days 7 to 8 after birth is generally going to be one of those days where hormones fluctuate and things might be a little more intense and where you might need extra support and help. As a midwife once told me one time, she said, on these days, maybe those days to where, the mom says, hey, I really need a milkshake, will you go out and get it? And then dad goes out and gets it, and then he comes back and she's dry heaving because he left her, So you have all these hormones going through your body, and it's this change on these days. So you need extra support on those days, and just peace with yourself and understanding and knowing that this will pass and this is all part of it and that you can get through it. I mean, you birthed a tiny human, so you can get through this with support, and also your support system being understanding that when this does happen and you do come back and you're dry heaving, this is what's going on days, 3 to 4 and 7 to 8, somewhere up in there. So you'll have that hormone shift. But also it's still important to continue your prenatal vitamins, especially if you're breastfeeding, and any supplements that your care provider has suggested you do after birth, during the postpartum. Generally, you may, when your milk comes in and you have that letdown, that'll be something that you have to get used to as well, because especially since it's when your first time breastfeeding, as that milk lets down and it kind of shoots out, you're like, wait, what's going on? So something to look out for. And as far as the first bowel movement after birth, that's very interesting, but don't let it scare you. This too shall pass, so you can get past it. There's different things you can do for that as well. You may also have after birth pains. So you can also use something called After Ease for those. It's by Wish Garden, or you can order it online. It's called After Ease. It's really good for cramps and after birth pains and things that you might have. And then you may not have these, so it may not be something you have to deal with. The lochia, the bleeding after birth, this can last for, the first few weeks afterwards, They expect it to be kind of heavy for the first 24 hours, possibly kind of like a heavy period, and eventually it'll kind of lighten up like the period would later on. But, say something. So if you're saturating a thick pad in less than 30 minutes, you need to lay down and massage the top of your uterus and possibly nurse your baby, because if you're soaking through that thick pad in less than 30 minutes, we need to try these things. Like I was talking about, lying down, massaging the top of the uterus, nursing your baby. And then if you're still having problems with that, and your bleeding hadn't slowed down to normal within a few minutes, you may want to call 911 to let your midwife definitely know, your care provider, and you may want to get to the hospital because you may have some, delayed hemorrhage going on or something like that. But generally, there's nothing to worry about and everything goes as planned, but just in case. So the final shedding and the healing of the placenta site, it usually takes about 10 to 14 days after delivery. So you kind of know what to expect as this is healing. You may still kind of be bleeding. So you may want to adjust your activity. If you notice more bleeding as you start to get up and around and about and start to doing things, body's telling you, whoa, hold up, you're doing a little bit too much there, slow your rolls, let's go back to bed. So, kind of use that to gauge how things are going. You want to have as much skin-to-skin contact with your baby in these first few weeks as possible. I know there'll be family members coming in wanting to hold the baby and wanting to spend time with the baby. Well, that's your special time with your family and your baby. And like I said, skin-to-skin contact is really important, and that's key for forming a good bond and growth and development. You want to air dry the cord. Try not to don't get it wet. You can put different herbs on it if you feel like it may be starting to get infected. You know, it's normal for the cord to come smelly and sticky at the base. I mean, it may do that, but you know, signs of infection include like heat and redness around the area, a temperature or something like that. Then, you know, it may be oozy. If it hasn't fallen off around day 5, then, you know, you can put a tiny amount of hydrogen peroxide can kind of be applied. And if you feel that, you know, you need something additional, you can contact your midwife or your care provider. Let's see. You can, you know, sponge bath the baby after the cord falls off. You know, until the cord falls off. I mean, you can kind of wipe the baby if you like, sponge bath until it falls off, and then after that, you know, you can submerge the baby, or not submerge the baby, like drown it, but you know, the cord as far as the belly button. You can keep a bulb syringe handy if you need to clean anything out or anything like that of the baby's airways and all, but it should be fine. Most babies should have at least one bowel movement and urination within 24 hours. So if you haven't had one within 24 hours, you know, you just kind of want to watch and observe. You may want to let your care provider know. Because urination can be kind of difficult to catch sometimes, especially with, you know, baby newborns and things, and you're half asleep and you're just kind of like, what? You know, but, you know, it can be done. So you can try placing a little tissue in the diaper, in the front of the diaper for little boys, or a little further down for girls, to kind of catch the urine, to be able to see if it's wet or not. You know, if you're really having issues doing that. The first 12 hours, your baby may want to nurse continuously, or it may not want to nurse at all. Anywhere from, you know, 1 to 2 times, that's fine. Just concentrate on proper positioning and proper latch as you go, rather than frequency, you know, because it's important to get that technique and that latch down, and you will get that, and you'll become a pro at it in no time. And as always, if you have any concerns about breastfeeding, you can always contact your care provider, your midwife, or your doula, and they can help you with that. After the first 24 hours of feeding, make sure, you know, feeding should be offered every 2 to 3 hours. The baby generally eats every 2 to 3 hours around the clock, you know, to reduce engorgement and to help produce your milk supply. So you'll kind of, every 2 to 3 hours generally is how the baby will eat. Let's see. What else was I gonna talk about? Like we said, your baby's first stool, we talked about that, and the meconium. You can also use some olive oil or something like that to go on the baby's bottom to keep that meconium from sticking and from being so hard to get off the skin. So you can kind of lightly wipe the baby's bottom with some olive oil, and that'll keep that from sticking and making such a big mess until that's passed and you start having regular, you know, stools. So during postpartum, you want to watch out for like the postpartum blues and postpartum depression. And any signs you may have of that, like you know, you want to avoid fatigue in the first 2 weeks. So try to go to bed at regular times. As they say, sleep when the baby sleeps. Yeah, for some moms, you're like, what? No, I can't do that. I got dishes to do. But, you know, don't worry about the dishes. Let somebody else handle that. You rest when the baby rests. You know, don't climb stairs. Don't be lifting anything heavier than your baby. Let visitors and families prepare the meals and do the cleaning. You know, just kind of get as much rest as you can, because I mean, this can be an overwhelming time, but you did this. This is awesome. So, you know, perineum care, you probably be provided with this peri bottle, and you can put in some of the things from your herbal bath in that, and it's nice and refreshing to kind of spray up in there, get things healing and get things going. Diet, you may want to continue to follow your prenatal diet, especially if you're breastfeeding. This way you make sure you get enough that you need and that your baby needs. for the first week, you don't really want to do anything at all. And then maybe after 2 weeks, you can start adding stuff back in slowly and just kind of go from there and see how it goes. After 2 weeks, you can start maybe taking short walks or different things like that, but you don't want to jump back into an extreme exercise routine. You want to slowly work your way back into that and let your body heal and have the time it needs. If you're breastfeeding exclusively, as far as your menstruation and your cycle, you most likely will go several months without that returning if you're exclusively breastfeeding. But the return of ovulation and things, there's no guarantee. So I mean, you really don't want to use, well, I'm strictly breastfeeding, that's my birth control, because there has been women that were breastfeeding that did wind up and become pregnant again right after. Irish twins. So anyway, you kind of want to watch that and, you know, kind of go from there. But you know, usually you may want to wait 4 to 6 weeks before continuing any sexual activity. At least 4 to 6 weeks. Make sure everything's healed up, especially if you tore and you have sutures and things. You definitely, you know, want to let that heal up before you go exploring down in that area. Let's see. Then the diastasis recti, that's something like, you're like, what is diastasis recti? Well, diastasis recti is where the muscles in the abdomen kind of during pregnancy, everything stretches out and they kind of pull apart. So then you're left with those ab muscles that are kind of pulled apart, whereas where they're supposed to be together. And there's things you can do for that, and there's also pelvic floor specialists that you can see after birth that will help with the repairing of these tissues and these things to help get everything back to where it was originally, and get you just ready to go again and get you back in the game. But like I said, that's just a kind of quick overview of postpartum and, you know, things after birth. We've already talked about the newborn screening and the test for the newborn and things in a different video, but I'll review those right quick. You could have the newborn screen, which is the heel prick, and it tests for, you know, the different congenital different disorders and things. Then you've also got the CCHD screening, where the oxygenation of the postductal, preductal and postductal is measured from the hand to the foot, and that tells if there's any congenital heart defects or anything going on. Then you can also do the newborn hearing screen as well, but that will have to be referred out, I believe, to a specialist for that. And we've also recently talked about jaundice, whereas, you know, if your baby has a yellowing of the skin, about getting sunlight, and, you know, the breastfeeding will definitely help with that as well, but that was in a different video. You know, as far as circumcision, that's strictly something that you have to research on your own. There's a thing called holistic circumcision, and I know in Texas somewhere a rabbi that does it, but this is something, like again I said, that you just kind of want to research on your own and make your own educated decision about. Finding time and space for you and your baby and your husband or your partner, and able to just process the birth and go over the things that happened, and if you have any questions, and just be able to work through any of that together is really awesome after the birth. Writing your birth story, you know, from your point of view, there could be several people at one birth, and then we all walk away with a different take on that birth. So it's really important, while it's still fresh in your mind, to get that birth story wrote down on paper, so that later on you're able to tell your child, okay, this is what happened on that awesome day you were born. You know, like I said, because, you know, even if the midwife writes the birth story or the student writes the birth story, it's from totally different perspectives as compared to when the mom or the birth person writes the birth story. You know, that's their own personal experience. So it's really important to get that down and get those thoughts down on paper and process that birth. But like I said, we're here to support and to educate. And if you have any questions, feel free to email us at info@southernhomegrown, or on the contact page on the website, southernhomegrown.com. All right, thanks, and have a great one.